A silent struggle understanding strangulation. This often overlooked form of violence can have devastating consequences. Strangulation is a serious form of assault, often used to exert power and control over the victim. It involves constricting the neck, cutting off airflow and blood supply, which can lead to unconsciousness or even death within minutes. This act can be committed with hands, ligatures, or even objects, making it a versatile and dangerous method of harm. Strangulation is often a silent crime, leaving few visible marks, which can make it difficult for victims to prove their abuse. This makes it difficult to detect and prosecute, as the lack of physical evidence can hinder legal proceedings. Understanding the science behind strangulation is crucial for both medical and legal professionals. It reveals the severity of this type of assault, showing how quickly and severely the body can be affected. It also helps to understand the potential for long-term damage, which can include neurological issues, PTSD, and other chronic conditions. It is not just about the immediate threat to life, but also the lasting physical and psychological impact. It's about the lasting impact it can have on survivors, affecting their mental health and quality of life. The effects of strangulation are immediate and terrifying, causing panic and a desperate struggle for air. The body's delicate balance is disrupted within seconds, leading to rapid physiological changes that can be life-threatening. The lack of oxygen sets off a cascade of events, affecting every system in the body, from the brain to the heart. It is essential to recognize the seriousness of strangulation and to educate those who may encounter it. This knowledge is crucial for medical professionals, law enforcement, and the public, ensuring that they can respond appropriately. Early intervention and proper care can make a life-altering difference, potentially saving lives and reducing long-term harm. Immediate impact. Oxygen deprivation and its effects. Oxygen deprivation, also known as hypoxia, can have severe and immediate consequences on the human body. Oxygen is the lifeblood of our bodies. It is essential for the survival of every cell and organ. Our cells need a constant supply to function. Without it, cellular respiration, the process by which cells produce energy, is compromised. When the flow of oxygen is disrupted, the body goes into survival mode. This means prioritizing vital organs like the brain and heart. Strangulation cuts off this vital supply, triggering a chain reaction. The body immediately begins to suffer from the lack of oxygen. The most immediate effect is cerebral hypoxia. This condition occurs when the brain is deprived of adequate oxygen. This means the brain is starved of oxygen. Brain cells begin to die within minutes without oxygen. Within seconds, the victim may experience confusion and dizziness. These symptoms are the brain's way of signaling distress. Loss of consciousness can follow rapidly. This is a critical warning sign that the brain is not receiving enough oxygen. The heart, deprived of oxygen, struggles to pump blood. This puts immense stress on the cardiovascular system. This leads to a drop in blood pressure and an erratic heartbeat. The heart's rhythm becomes unstable, further endangering the victim. The body's natural response to oxygen deprivation is to gasp for air. This is an instinctive attempt to restore oxygen levels. But in a strangulation scenario, these attempts are futile. The airway is blocked, preventing any air from entering the lungs. The constricted airway prevents air from reaching the lungs. This exacerbates the oxygen deprivation, worsening the situation. The victim may experience a feeling of panic and desperation as their body cries out for oxygen. This is a natural response to the life-threatening situation. The duration of strangulation is a critical factor. The longer the airway remains blocked, the more severe the consequences. The longer the airway is blocked, the more severe the damage. Prolonged oxygen deprivation can lead to irreversible brain damage or death. Even brief periods of oxygen deprivation can have lasting consequences. Short-term oxygen loss can result in long-term neurological deficits. This highlights the dangerous nature of strangulation, even in cases that appear less severe. It is a life-threatening emergency that requires immediate intervention. The brain under siege. Neurological consequences. When the brain is under attack, the effects can be both immediate and long-lasting. The brain is the most complex and delicate organ in the human body. It controls everything we do, from our thoughts and emotions to our movements and senses. It is also the most vulnerable to oxygen deprivation. Without a steady supply of oxygen, brain cells begin to die within minutes. Even a brief interruption in blood flow can have a profound impact on brain function. This can lead to immediate symptoms such as confusion, dizziness, and loss of consciousness. Strangulation, by its very nature, poses a direct threat to the brain. The pressure applied to the neck can cut off blood flow and oxygen, leading to severe brain damage. When the brain is deprived of oxygen, neurons begin to die. This process can start within seconds and continue for several minutes, causing irreversible damage. This can lead to a range of neurological problems, depending on the areas affected. Different parts of the brain control different functions, so the symptoms can vary widely. Some victims may experience memory loss or difficulty concentrating. These cognitive issues can make it hard to perform everyday tasks or hold down a job. Others may suffer from seizures, vision problems, or even paralysis. These symptoms can be debilitating and require long-term medical care. The severity of brain damage is influenced by several factors. These include the duration of the strangulation, the force used, and the individual's overall health. The duration of the strangulation, the force used, and the individual's health all play a role. A longer duration and greater force can lead to more severe damage. In some cases, the brain damage may be temporary. With proper medical treatment and rehabilitation, some victims can recover much of their lost function. In other cases, it can be permanent, leading to lifelong disabilities. These can include chronic pain, mobility issues, and ongoing cognitive impairments. The long-term neurological consequences of strangulation can be devastating. Over time, the damage can worsen, leading to a decline in quality of life. Victims may struggle with cognitive impairments, affecting their ability to work, learn, and maintain relationships. These challenges can lead to social isolation and depression. The impact on their quality of life can be profound. Everyday activities that were once taken for granted can become insurmountable challenges, requiring ongoing support and care.